I'm happy that you mentioned blockchains because that sort of gives me a nice opportunity to ask you about the technical aspects of the health data research infrastructure. Now that we discussed a little bit the requirements from the organization, I'm wondering, are there also any technical requirements that you can actually sort of outline to have a healthy research infrastructure?
Sure, yeah. Um, so one of the questions that I had when we started building, for example, Health Orion, building the plans for Elixir NL, was how can we do that? And of course, we had a lot of discussions. We had a discussion just last year in Utrecht about it. And we came with the App Store metaphor that was brought up. So the idea is, let's build a unified national platform for health research, right? Where you have an app store that's, as a researcher, I can go in and I can, for example, build a workflow which would combine genomics data with medical history data in order to make a cancer treatment prediction. I think it's a great concept. However, when I made a presenter, I made this joke, with Admiral, what's his name? Is this Redis?
I have to say, I don't remember. He is my favorite character.
Yeah. Basically, I said, guys, this is a trap. We should be careful to try and design the super app store for a number of reasons. It's a metaphor, of course, so the metaphors can go wrong. But the App Store does kind of imply that it's easy to use, it's easy to set up, it's universal, which is true for consumer phones. But I think it's not like that for personalized health research, which is a very difficult topic. So if we could have anything close to an iPhone, I would already be very impressed. And more likely, it's going to be like a supercomputer in a building, if you would take the metaphor. So if we would go a little bit deeper, I think the challenge is that what we really need is an infrastructure that's federated, as I mentioned before, right? And one reason that's underlying this is Conway's law. Do you know Conway's law?
No.
Okay, I just put it on the screen. It's a 1968 paper. Quite cool sometimes to read these old papers because they have, I feel they're more like telling a story. They're more free-flowing. But the key from this paper is that he says that any organization which designs a system, it will do that. It will design a system, but the design of the system will look like the organization in which those people work. Specifically, it will look like the organization's communication structure. So if I say to a group of researchers, smart people, let's go, you need to build German's new personalized health infrastructure. And I let them do that in a way that they're all together in one building, they're going to do that. They might produce something, but it will not be hooked into the existing structures. So it's probably gonna fail, to come back to our title.
Yeah, it will be very similar to the organization that is taking place in that particular building, actually, but it will not necessarily answer the question that it needs to answer. But how do you solve it then? Because then I would say the logical next step is to bring together people from different organizations, because they can sort of correct each other and give different feedback, share their expertise. But I can imagine that always possesses another challenge of, it's very difficult to make a lot of people agree on one thing. Yeah. So is there a way to solve that?
I think it's what you say, right? So what you need to do is a multi-stakeholder approach. And to reassure our viewers, I picked on Germany as an example that was purely hypothetical. I think what all these infrastructures currently are doing is exactly this. For example, in Health Orion, this is from the ground up in the Netherlands designed as a multi-stakeholder initiative. So all the university medical centers are in there. There are people representing GPs, doctors. There are people representing patients and patient organizations. We have the insurance companies. We have the government, also very important. We don't have as much as I'd like the government, right? So, for example, we have VWS in the Netherlands, which is Ministry of Health. I would love to have the Ministry of Health seen driving this.
So government representatives, if you are listening, please show more initiative. We would like to hear more from you.